So thank you so much for coming, Dr. Ahmed Mostafa. And you are a dentist of over 12 years experience. And what you're going to share with me today is just absolutely fascinating. So I'm really, really excited to have you today.
I'm happy to be here. Thank you for having me. Yeah, sure.
So let's begin. What made you want to become a dentist in the first place?
Well, I come from a big family, and we have a lot of doctors, engineers. We have in every specialty, but we don't have a dentist in the family. So my mom encouraged me, and when I had a look, it looked fun. You know, it's a mix of medicine and art and talent. So it intrigued me, and yeah, with time I grew to love it more and more.
Wow. And so you went straight from school straight into dentistry, did you?
Yeah, so after high school, I went straight into dentistry. I graduated from Kuwait, went to Egypt, where I originally from, for uni, and then worked a little bit in Egypt, and then worked in Kuwait. So, been around, yeah.
Yeah. And dentistry or going to the dentist can be scary for many people. So can you explain the importance of the role of having regular dental checks for us?
Sure. So, regular checkups giving us a chance to detect any problem before it gets serious or get bigger. So, regular checkup saves a lot in the long run because you can maintain a good oral hygiene by just maintaining your regular checkup appointments. Catching anything from the beginning is so easier to treat and before it causes any irreversible damage. So it's really important.
So can you explain what is oral hygiene? Is it just brushing our teeth every day, or is it flossing, and how often do we need to floss? All those nitty-gritties.
All right, so oral hygiene is a main word to describe everything we can do to maintain a clean mouth and to clean our teeth, our gums. So when it comes to oral hygiene, we can divide it into four main things. So hard tissue, the teeth, to clean it perfectly, you have to brush it and floss it because brush cannot reach the areas in contact between the teeth. So flossing or Brexils or anything just to clean between the teeth, even a water jet, which clean in between the teeth. So that's the first part, cleaning the teeth. Cleaning the gum, make sure that the gum is healthy and clean and no deposit stuck on it. The tongue as well, so tongue scraping, and mouth rinse to cover all the other soft tissues, the cheek and the soft palate. Yeah. So
Right.
brushing, flossing, tongue scraping, rinsing.
So what are the most misconceptions out there that people about dental hygiene and dental care?
I believe the most two misconceptions we see. First thing is I will only go to the dentist whenever I have a problem with my teeth, which can be a little bit too late because the pain means there is a problem and this can be reversible or irreversible. So that's first misconception. The second one is that, yeah, it's just my teeth, you know, I'm gonna fix it. Even if I lose this tooth, it's all right, which is not the truth because it's a part of your body and you are one body, it's all connected. So even losing one tooth can cause some damage to not only the way you bite and your mastication and the quality of your digestion, but also even your posture can be changed if you don't have a stable good bite. So these are the two misconceptions. I will only go if I have a problem, or yeah, nah, it's just a dental appointment. It's just my teeth. It's like it's not treated as important as the, you know, if you have a high blood pressure and you have to take your medication or diabetes. No,
Yeah.
it's something really serious, especially if you have these things.
Yeah. People leave it till last minute, don't they?
Exactly.
It's not really a proactive. Well, we try and encourage proactive going to the dentist. I literally went yesterday for a
Yeah,
clean.
perfect.
So what are the early warning signs of poor oral hygiene? What are the signs and symptoms that we might be experiencing to look out for?
So, a puffy swollen gum, changing the color of the gums, bad taste, bad odor, bad smell. Some people, even in more severe cases, can start complaining about, I feel my teeth are moving, which
Right.
means gum disease is on second level. So, yeah, swallowing gum, bad taste, bleeding, of course, but sometimes bleeding can be delayed, so it can be too late, or it can be an early sign, depending on the general health of the patient as well. So we have to always check the medical history and the family history for our patients to correlate it to the signs and symptoms we have.
And that's gingivitis, isn't it? Gum disease.
They found a relation that it runs in the family. So yes, if someone have a family history of gum disease, they have high probability to get it, but it's about all the factors. So it's one of the factor. It doesn't mean you will have it. So if we can prevent the other factors, then the gum disease is not gonna happen.
So what's the difference between the terminology of gingivitis and periodontitis?
All right. So gingiva is the medical name of gum. So gingivitis is the inflammation of the gum, which is considered infection as well. But the gum have two parts. Unattached part, which is the top part next to the crown of our teeth, and the attached part under it that extends even from the inside, the ligaments holding the root to the bone. So this all is the gum or the gingiva, not just the outer part.
Right.
So gingivitis is the top part. So it's the first stage of having a gum disease. It is reversible. So we can detect it, stop it, and with time and good oral hygiene, gums can go back to normal. The second stage is the periodontitis. Perio, which means around the tooth, inflammation. So periodontitis. This means the ligaments holding the tooth to the bone or to the inside. Sometimes with time, the gums needs more space to move away from the inflammation source. So we start losing our bone. So the gum moves away more and more, and we start having bone loss. And this is periodontitis. So it's the extreme form of the gum disease. This is the difference between gingivitis and periodontitis.
So do our gums recede over time naturally, or is that something we can prevent as well as we get older?
It will recede, but not significantly, but we can prevent it as we get older. So because there are a lot of factors into when it comes to gum recession, it can be a sign of becoming old, with time and with usage, with every time you eat, the food
Pushes the
gets
gum
stuck
up?
and pushes the gum. So with time, it starts to recede, but there is a normal range for recession as well, but it can be prevented.
So is there particular groups of people that are more prone to gum disease or poor oral hygiene than other people? For example, diabetes or smokers?
Well, exactly. Thank you for bringing this up. So, remember when we were talking about the early signs of gum disease and we said the bleeding? So, smokers or people with the habit of smoking tend to have less bleeding because the peripheral blood capillaries tend to shrink and minimize. So, the bleeding comes too late, and sometimes by the time bleeding happens, it's already too late to repair what happened and the gum recession and the bone loss.
Right.
So people like people with diabetes as well, they have higher percentage of getting gum disease. So by higher percentage, being diabetic, having the food particles stuck, improper oral hygiene, all of these are factors into getting the gum disease. So if we remove the other factors, this factor by itself, being diabetic, is not gonna be enough to create the gum disease. So as I said, this is one of the most important reasons for the regular checkup and clean, to remove these factors. So diabetic patient, people with smoking, even drinking alcohol, a lot of alcohol can affect the gum. bad diet. So, yeah,
Because diabetes being high blood glucose as well, and sugar is where a habit and an environment where bacteria love to thrive, isn't it?
exactly, exactly.
Yeah.
So it's not just the presence of the high sugar level in our saliva and in our spit, creating a lovely environment for the bacteria to grow. And one of the other factors with diabetes is the same thing with peripheral blood cells as well. So we need blood to heal. It has the white blood cells and the red blood cells. So in order for the body to defend itself and heal, it needs a good blood flow, which is hard with smoking and having a high
Yeah.
blood glucose level. Yeah.
Yeah, and I really want to stay with this poor oral hygiene because it can lead to systemic infections where that bacteria just runs through the whole body. And for example, I'm just already thinking of endocarditis, which is where the vegetation sits on the heart valves, predominantly the mitral valve and the aortic valve. So I know poor oral hygiene can cause systemic infections, and as well as many years ago, it was like tattooing, or the bacteria can enter from the digestion or a fungal approach. So, how important is it for that poor oral hygiene because of the risk of it becoming a systemic infection across the body?
So it was a great example, the endocarditis as well. So, like it was linked to the heart infection, one example in the Alzheimer's Journal 2020, a study that ran for 23 years, I think, 23 years.
Wow.
Yeah, over 23 years on 6,000 participants. They found that the bacteria, one of the bacteria responsible for gum disease, PG gingivalis, they found it in the fluid brain of Alzheimer's patients. So it started a debate. Is it cause and effect or not? So they couldn't reach that this caused this, or having Alzheimer's encouraged the growth of this. But to have this type of bacteria up there, it it definitely have a link.
Yeah, wow.
And then another study was done, and they found that having a good oral hygiene decreased the risk of having heart disease by 30%.
30%, that's huge.
30%. So it is related because we are one body. And even if we have different systems like the vascular system, the respiratory system, it's still all connected. Respiratory system helps giving oxygen to the vascular moving the blood. So we are connected. We have a high vascular mouth, so bacteria can travel through blood from our mouth up to different areas. And I'm sure you remember some of patients where they have like valve replacement or infective endocarditis, early infection. Whenever we have to do any treatment that involves the blood, even deep clean and deep scale, we used to give them prophylactic antibiotic just to prevent the spread of infection.
Yeah.
So this is how important it is to realize the connection between our oral hygiene and our overall health.
Yeah, and I've looked after people with endocarditis, being cardiac background, and that present high fever or history of high fever, that always have a heart murmur because that vegetation's already sitting on that heart valve. And then they might even get tiny little blood clots in their fingers or their toes because that vegetation is breaking off and it lands up in the most distal part of the body, which is your fingers and your toes. And they're extremely unwell. So they'd have to be on IV antibiotics for 6 weeks.
6 weeks.
6 weeks, aggressive antibiotics for 6 weeks. And then they would look at the condition of the heart valve, and if it was too damaged, they'd either go in for surgery for a repair or a total replacement. It's that serious, and you could sometimes see on the imaging, and you can actually see these little vegetative little
Blobs, little
crustaceans, blobs,
crystals.
yeah,
Yes,
sitting
yeah.
on the valve, and then it sits on the chordae tendineae, which is like the parachutes holding the valve, and then they sit on the papillary muscles, and the longer it is left, the more damage is done. And yeah, it's just so high a risk that that connection of poor oral hygiene can lead to systemic an
Yeah.
infection that's carried from the bloodstream, and it's coursing through the heart, and it lands either in the mitral valve predominantly or the aortic valve. It's just huge, and they're just so unwell.
Yeah, it's my first time to know it was 6 weeks antibiotic
Yeah,
as well.
because
Yeah,
if you don't get that all of that vegetation, then it can
gonna
grow
stay over
again.
again. Yeah, of
So
course.
they normally go home to hospital in the home, and then their IV antibiotic is replaced every 24 hours to keep that going. Yeah, it's crazy
It
that,
is.
and
It is.
that link again is look after your mouth, go to your dentist
Yeah,
regularly.
it is your gate to your body, and we are
Yeah.
what we eat. So our diet, it's really important. Yeah, thank you for bringing this up.
Well, that it's just so important,
It's
isn't it?
yeah,
Which is when I met you, and this is what I absolutely love, is that you have one of the few in Australia and probably one of the few in Queensland, and you are testing oral microbiome testing. And when I met you, it was like I was fascinated to see what you're doing. So can you explain to the audience, please, what is oral microbiome testing?
So in oral microbiome testing, we take a sample from the mouth, from different areas of the mouth to cover most of the oral cavity, and then we place it and we have a look under the microscope. And according to the type of germs and bacteria we see, sometimes there can be even in severe cases parasites. So according to the presence of the microgerms, bacteria and parasites, the type, the number, and the activity to these things, and linking it to the patient medical history and family history, we can determine the level of risk the patient is at. So according to this, we tailor a treatment plan specific for our patients. So instead of just doing that regular check and clean and tell the patient, all right, see you in 6 months, and by the time he comes back, a permanent damage can happen.
Yeah, wow.
Whatever, so bone loss, it's irreversible. You will lose your bone, you lose the support for your teeth. So it's really important to have a definite treatment plan for every patient in accordance to what the results of the investigation we have. So it's
Yeah.
really fascinating when we look under the microscope and be able to know exactly what's happening.
So how many back to the machine.
Yep.
So how many bacteria, and you even said sometimes parasites it picks up.
Yeah.
So how many does the machine look out for in numbers of bacteria? Does it know 12 different bacterias, 100 different
So
bacterias?
looking in the machine, we define, so in our body, we have good bacteria, bad bacteria living in equilibrium. So it's in oral cavity, it's inside our guts. So we have bacteria, but the equilibrium and the balance between the bacteria, this is what decides, are you in a healthy stage or in the disease stage? So when we have a look, we see that with the certain shape, the types of bacteria we have. So we know these shapes are the healthy bacteria. These shapes are the
Aha,
bad
right.
bacteria. Oh, these shapes are the really bad ones. These are parasites. This is a red blood cell. This is a white blood cell. When you see a lot of red and white blood cells, it means there is an infection going, there is this is our defense mechanism, so you know there is something going there. So, and this is why we take the sample from different parts from our oral cavity, and we have to look in the whole sample. We don't just, whenever we see, that's it, we have to move, we have to wait to see the movement of the slow things. So it's really fascinating, but when it comes to knowing exactly what's going on, we have a lab where we can take uh, like
Saliva
saliva
test.
swipe, saliva test, send it to the lab where it comes back with definite types of bacteria, their percentages, what is the normal range, and the advice how we can treat it in the best way.
Yeah.
So
So, Dr. Ahmed, do you test that with all your patients coming through, or is it patients only going to pre-procedure, or how do you utilize this machine?
So our check, clean and check our appointment, this is a main part of it. We start with this by
Right.
taking the sample. So according to the results, we determine when we need to see the patient again and the best way to him to maintain the oral hygiene level at home. So if the patient comes back with no improvement in short time, then no, we need to be proactive. So we take the swab and send it. But it's the swab part is not from the first appointment. First appointment, we take the microbiome sample, we test it under the microscope, and according to the results, we decide is it necessary to do this saliva swab or not.
Do the majority of your patients, are they medium risk? Do you ever see high risk patients coming in where their bacteria in their mouth is really, really high bad bacteria?
So,
Is that common?
so we cover a wide range of patients. So we take care of kids, grown-ups, elderly. So we see a lot of samples, and unfortunately, yeah. So we see a lot of high-risk patients when we don't like to see it. So mostly it's moderate to high. And I think the most important part is for the patient, when they see, they believe. When they see, they believe. And it helps them to motivate them to take care of their oral hygiene themselves at home, because whatever we do, it's a part of the answer. The true treatment is done by the patient. So we have to make sure our patients are motivated and they feel confident on the ways they use their instruments and products to clean their mouth.
So let's say they've come in and they've got poor oral hygiene and their bacteria is quite high. What do you recommend for them? Is that where they begin with, regular flossing and brushing your teeth? What else do they need to do? Is it changing their diet as well? What improves that microbiome in their mouth?
So, like for example, let's say the patient comes and they're doing a very great job with their brushing, flossing, tongue scraping. Everything is great, but the sample says otherwise. We start asking questions. Did you take any course of antibiotic lately? Did you take prebiotic and probiotic after this course? Do you have? So it's an investigation. So it's like we have to sit together with the patient and have time to talk and know exactly what's happening so we can change this.
That's really proactive, isn't it?
Of
I
course,
mean,
yeah.
by you investigating and helping those people with the microbiome, and then obviously if it's high, that's where you would just hold and suspend any procedure that you were going to do. Let's say somebody's coming in for a crown, well, you would hold that, wouldn't you, until you've got their microbiome in a healthy range. Would that be right?
Of course, of course. So let's say someone wants to come and start his orthodontic treatment, for example. It can never be done when you have a gum disease going on, because it's just going to make it worse. We have to stabilize it first, make sure it's stopped, reversed if we can, and then and only then we can start with other treatment. But so like sometimes when we have a very bad oral hygiene, it's not even an indication to place a bridge. So to replace a missing tooth with a bridge, we cannot do it if the patient have an ongoing gum disease, because we are putting more force on the other teeth where they are not, they don't have a healthy support. So yeah, it will stop any treatment until we make sure we can stabilize it first.
That's right, because it would teeth could move, couldn't they? If they got gum disease, and then you're trying to, measure for a denture, for example, if you got that gum and the teeth healthy, they're not going to move as much either, are they? And then you can measure for the denture.
Exactly. So, unfortunately, most people are not aware of this, but the first reason for adults to lose their teeth in Australia is due to gum disease. So sometimes we'll have patients come and they are losing their teeth, and if you look at the teeth, it's perfectly fine. The tooth itself, it has no cavity, it has no previous fillings, nothing. But because the gum around it, you can see these crystals, black crystals stuck to the side of the teeth, causing the gum disease and the inflammation and the bone loss. So teeth definitely move if you have an ongoing periodontitis and severe gum disease. Yeah.
And so back to the slide, because I think this little machine's fascinating. So back to the slide, are you looking at the number of bacteria that are there as well?
Yes, yes. So we're looking at the number of bacteria, the shape and the type of bacteria, and the activity of the bacteria as well, if it's active, and the movement. So
What does that mean when they're really active?
remember when we talked about the high glucose level in our
Yes.
saliva and spit? So this is a favorable environment for them.
Oh, they're thriving.
So, exactly. So if we have a lot of calculus, which is the hard layer that form with time due to the deposition of the minerals and the germs and the food particles and everything together, with time it starts to harden. So it's like a safe home for them to breed and increase and excrete all the chemicals that cause all these irritations. So this is why a clean and a deep clean to remove the source itself of the inflammation, because if you do a good oral hygiene while this layer is stuck deep there, it's not going to remove it. So this is when we start. We start with removing the source of the inflammation, the source of infection first, and then oral hygiene measures come.
Right. Because when I saw you that day, I did want to do it, but somebody had just given me a little slice of chocolate. I thought, no, I don't want to do it, because that would affect the reading, right?
Yeah,
If you had just eaten something, that would affect the reading, wouldn't it?
It takes time for the enzymes to digest this, so it's not momentary. And so this is why we also take the sample from different parts, especially from in between the teeth as well, to show us what's happening there and what's been happening there for a while. Another thing we use is disclosing gel. So it's like a special dye when we apply it on the teeth, and then after we wash it, it shows us exactly the areas that been missing when we brush our teeth and when we floss.
Right.
And it even shows us approximately how long have it been there. So even if we just eat something, we can detect if this deposition or this activity, was it something recent, or this is the moderate range of.
Why? Because of the discoloration to
So
the dye?
Yeah, and from the places we take our sample as well. So from in between the teeth, it takes time for the dissolving to happen with the enzymes and everything for this deposition to happen. So we take from things that we know it's already been there for a while. So
Wow. So do you think people know enough? Is it advertised enough about looking after your teeth, looking after your gums? It's a bit like heart disease. People don't really think about it until it happens.
yeah, and unfortunately, a lot of times it is almost too late.
Yeah.
But just to be optimistic, but yeah, we need to have a better way to communicate with the public and our patients, and to have enough time to educate our patients with the risks and the connection of the oral health with the heart health, with the general health, and it's really
It's all connected, isn't it?
exactly.
Exactly,
So,
like endocarditis is a classic example.
yeah,
Because yes, you can get endocarditis, say, through intravenous drug use or from digestive infection, but dental is one method of endocarditis coming and affecting the heart. So is there any message you want to give the audience that you really want to pass on to them?
So
Being a dentist, what do you want to tell them?
So, the prevention is the best cure. Prevention, and it's really easy to do it. Just maintaining the regular checkup and clean appointment is gonna save you a lot in the long run. If you think about it, if you visit the dentist, let's say, if you're a high risk, you're gonna start with maybe 1 month, 3 month recall. Once we see an improvement, it's gonna be 4, 6 months. If we see an amazing results, you know what you're doing, you're motivated, you have the tools to do it, I'm gonna see you in a year.
Right.
So it's really easier and more convenient for the long run to maintain these appointments, the checkup and clean appointment. Make sure you are on top of everything instead of waiting until the problem happens. So a little cavity, a small filling, few dollars. Big cavity, bigger filling, a lot of money. Root canal treatment, crown. And it's not just about the money, it's about losing your natural tooth structure. So you have a gift here, so keep it, because losing it, it's gonna cost you a lot of money and time to replace it. So yeah, I think, and of course, realizing the importance and the relation of maintaining a good oral hygiene to having a healthy life. So I think these are the most important things I have to say.
And talk about healthy life. So I want to ask you a personal question now. What do you do to maintain your health?
So
Which is what I ask everybody. So
yeah, I try to have a break every then and a while. Go for short walks. I'm not a fan of long walks. Going to the gym, yeah, if we have time.
okay. And what's your favorite thing to do that you like to relax?
Going to the beach, I think, yeah, being next to the sea, it's really relaxing. Fishing, of course, but mostly I go to feed the fish, not to get fish. So, yeah.
And so if somebody wants to find you, Dr. Ahmed, how do they go about finding you as a patient or microbiome testing? How do they find you?
So we do the microbiome in both our clinics at Esteem Dental Care. We have one in Ashmore and the other one in Robina. We have microscope at both locations, and it is a part of our deal for the checkup and clean to have the oral microbiome test done and disclosing gel. So our checkup and clean appointment is the first time is for 70 minutes. 70 minutes to have enough time to talk to our patients, know exactly what's going on, and go through the oral hygiene instructions, making sure they are confident to do it themselves at home. So,
yeah. Well, thank you so much
Thank
for
you so
being with
much
me
for
today. I
having
just
me.
think
Yeah.
what you do is a really unique space in finding people's and testing people's oral microbiome, because I think once they've got that connection that can lead to systemic infection, it's a godsend that you've got this machine. So I do thank you for your time.
Thank you for having me, and thank you for pointing this important point, the relation between the oral hygiene and the heart health and general health. It's really great, and thank you for doing this, as we need to educate more people about this. So thank you.
Absolutely. Thank you so much. Appreciate all the work you do in this space.
Thank you. Thank you.
If you like this podcast, please share, like, and subscribe. Also come and visit. The website is heartcoregroup.com, and we're also on Spotify, and YouTube is Heartcore Junction. Thanks so much for watching. Until next time.